Hello. I want you to listen closely to 3 urgent phone calls, 3 real-life scenarios. First, a call from Sarah, 35, working from home. Suddenly, she couldn't see the numbers on her screen, and when she tried to tell her husband, the words wouldn't come out. An ambulance was dispatched in under 5 minutes. After receiving a powerful clot-dissolving medication, she was speaking normally just hours later, with no permanent damage. Next, a call about Robert, 65, a retiree enjoying his morning coffee. He suddenly collapsed while getting up from his chair. He had ignored his high blood pressure for years, thinking retirement meant less stress. Robert survived, but he spent months in physical therapy, learning to walk again and struggling with the weakness on his left side. Finally, a call from Maria, 59, to her son. During their chat, her speech suddenly became slurred for about a minute, and she felt a strange numbness in her arm. Just as quickly, it vanished. She told her son, "Don't worry, it passed. I'm fine." But her son knew better and insisted she go to the emergency room immediately. A young professional, a retiree, and a mother talking to her son. What could possibly connect these 3 frightening events? Every one of them was experiencing a stroke, and in this video, you're going to learn how to recognize it, what to do, and most importantly, how to prevent it. Hello, I'm Dr. Kenji Sato, and welcome to the Senior Wellness Center. Our mission here is simple: to give you the clear, practical knowledge you need to live a longer, healthier, and more independent life. Today's topic is one of the most critical we've ever covered, and understanding it could truly save a life, maybe even your own. A stroke can happen to anyone at any age, and the statistics are staggering. In the United States, someone has a stroke every 40 seconds. It remains a leading cause of serious long-term disability and a primary reason why many seniors lose their independence. But these aren't just numbers on a chart. They are parents, grandparents, neighbors, and friends. The single most tragic part of this is that many devastating outcomes could be prevented or significantly minimized if more people just like you simply knew what to look for and how to act. Knowledge, in this case, is not just power. It's the power to save a brain, to preserve a life, to keep a family whole. That's why this video is so important. So before we dive into the details, I have a small favor to ask. Please take 1 second to hit that like button. It's a simple click, but it tells YouTube that this is critical health information that more people need to see. It truly helps us spread this life-saving message. And if you're committed to your health journey, please subscribe and click the notification bell. Together, we can build a community dedicated to wellness and longevity. Thank you for that. Now, let's understand what is really happening inside the body during a stroke. So, what exactly is a stroke? In the simplest terms, a stroke is a brain attack. It happens when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting the oxygen and nutrients it needs. There are 2 main ways this can happen, which we'll cover shortly. But the result is the same. Brain cells begin to die, and they die fast. This is why you'll hear doctors use the urgent phrase, "Time is brain." For every minute a stroke goes untreated, the average person loses nearly 2 million brain cells. These are the cells that control everything: your memories, your ability to speak, your capacity to walk and live independently. They don't just grow back. The urgency of this cannot be overstated. When I graduated from medical school over 2 decades ago, the outlook was often grim. When a patient arrived with stroke symptoms, we would perform a scan, and if there was no bleeding, our options were limited. We would often just give them aspirin and wait, watching as the damage became permanent. It was heartbreaking. But today, medicine has made incredible advancements. We now have powerful time-sensitive medications that can dissolve the very clot causing the blockage, restoring blood flow and saving brain tissue. We even have advanced procedures where we can physically go into the artery with a catheter and remove the clot directly. I've seen miracles happen. Patients who arrive unable to speak or move one side of their body can, after rapid treatment, start to recover function almost instantly, speaking clearly, regaining strength in their limbs. It's like magic, but it's science. And it all depends on one single factor: time. This brings us to the most critical piece of advice in this entire video. If you or someone you're with shows a NY sign of a stroke, you do not wait to see if it gets better. You do not lie down for a nap. You do not give it a few minutes. You call 911 and get to an emergency room immediately. Every single second you wait is a chance for more permanent brain damage to occur. Your action in that moment is everything. But how can you be sure? In a moment of panic, it's easy to freeze. That's why I want to give you a very simple, powerful tool that you can remember and use instantly. It's an acronym called Be Fast. Memorize this. It could be the most important thing you learn today. Let's break it down. B is for balance. Is the person suddenly experiencing a loss of balance or coordination? Are they stumbling, feeling dizzy, or unable to walk straight without warning? This is a major red flag. E is for eyes. Has the person suddenly lost vision in one or both eyes? Or are they experiencing double vision or blurred vision that doesn't go away? Ask them, how many fingers am I holding up? Any sudden, unexplained vision change is a serious sign. F is for face. This is a classic one. Ask the person to give you a big smile. Look closely. Does one side of their face droop or seem numb? Is the smile uneven or lopsided? Facial drooping is one of the most common and recognizable signs of a stroke. A is for arms. Ask the person to raise both of their arms straight out in front of them, like they're holding a pizza box. Can they hold both arms up, or does one arm drift downwards? Arm weakness or numbness, especially on one side, is a critical indicator. S is for speech. Is the person's speech slurred or strange? Are they having trouble speaking or being understood? A simple test is to ask them to repeat a short phrase, like, the sky is blue. If they can't repeat it clearly, it's a significant warning. And finally, the most important letter. T is for time. If you see any of these signs, balance, eyes, face, arms, or speech, it is time to call 911 immediately. Note the time the first symptom appeared. This information is crucial for the medical team. Don't drive them yourself. Call for an ambulance. Now that you know how to spot a stroke, let's quickly understand what's happening behind the scenes. The BE fast symptoms are the result of two main types of stroke. The first, and by far the most common, is called an ischemic stroke. This accounts for about 85% of all cases. Think of it like a plumbing blockage in the brain. An artery that supplies blood to a part of the brain gets clogged by a blood clot. This clot can either travel from another part of the body, often the heart, especially in people with arrhythmias, or it can form right on the spot, on top of fatty plaques that have built up inside the artery walls over time. The end result is a traffic jam. Blood can't get through, and brain tissue is starved. The second type is a hemorrhagic stroke. This is less common, but can be very severe. Instead of a blockage, this is a rupture. A weakened blood vessel in the brain bursts, causing bleeding into or around the brain tissue. This not only cuts off blood supply to the areas beyond the rupture, but the leaked blood itself puts pressure on the brain, causing significant damage. Now, I want to address a very important and often misunderstood event, the TIA, or transient ischemic attack. Many people call this a mini-stroke. This is what Maria experienced in our story at the beginning. The symptoms are identical to a stroke-slurred speech, weakness, numbness, but they disappear on their own, usually within a few minutes to an hour. It's tempting to feel relieved and think, well, the problem solved itself. This is a dangerous mistake. A TIA is not a minor event. Think of it as the fire alarm going off before the entire building is engulfed in flames. It's a massive urgent warning sign that your body is sending you. The underlying condition that caused the temporary blockage is still there. Having a TIA dramatically increases your risk of having a major permanent stroke, often within the next few days or weeks. So let me be perfectly clear. You must treat a TIA with the exact same urgency as a full stroke. Even if the symptoms are gone, go to the emergency room immediately. It is your best chance to find the cause and prevent a devastating event. So why do these blockages or ruptures happen in the first place? Understanding the causes is the first step toward prevention. While some risk factors, like a family history of stroke, are out of our control, many of the most significant ones are directly related to our lifestyle and health management. Other major causes include smoking, diabetes, high cholesterol, obesity, and certain heart conditions. But there is one risk factor that stands head and shoulders above all others. First and foremost, by a wide margin, is high blood pressure, also known as hypertension. This is the single most important risk factor for stroke. The reason it's so dangerous is because it's a silent force that relentlessly damages your arteries over years. Imagine the plumbing in your house. If the water pressure was turned up to its maximum, 24 hours a day, what would happen? The pipes would strain, weaken, and eventually they would either clog or burst. That's exactly what high blood pressure does to the delicate arteries in your brain. This constant elevated pressure damages the inner lining of the blood vessels. This damage makes the artery walls rough and stiff, which is the perfect environment for fatty plaques and blood clots to form, leading to an ischemic stroke. It also weakens the artery walls, making them more likely to bulge and eventually rupture, causing a hemorrhagic stroke. It contributes to both types, which is why it's so critical to control. And here's the most dangerous part. High blood pressure is often called the silent killer for a reason. You usually can't feel it. Most people have no symptoms at all, while this damage is silently happening inside their bodies. You could feel perfectly fine, while your risk for a devastating stroke is climbing higher every single day. So how do you fight an enemy you can't see? You have to measure it. The only way to know if you have high blood pressure is to check it regularly. And the first step in treating it properly is knowing your numbers consistently, not just once a year at the doctor's office. Having a reliable device at home is fundamental for this control. To help you take control of this crucial factor, I've selected a simple and accurate home blood pressure monitor that I trust. It allows you to track your numbers and share them with your doctor, so you can be sure your treatment plan is working. You can find it by scanning the QR code on the screen now, or by checking the link in the pinned comment below. Controlling your blood pressure is the single best thing you can do to prevent a stroke. And one of the most powerful tools you have to do that is your diet. I often get asked, Doc, what should I actually eat? It's a great question, because what you put on your plate every day has a direct impact on the health of your arteries and your brain. Let's make it simple. The goal isn't a restrictive, joyless diet. It's a smart, sustainable way of eating. The gold standard, which we recommend for heart and brain health, is the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. It's been scientifically proven to lower blood pressure and reduce stroke risk. But you don't need to get lost in the details. The principles are straightforward. First, focus on what to add to your diet. Load up on fruits and vegetables. Aim for 4 to 5 servings of each every day. Foods like leafy greens, berries, bananas, and citrus fruits are packed with potassium, which helps counteract sodium's effect on blood pressure. They are also rich in antioxidants that protect your blood vessels from damage. Next, switch to whole grains. Replace your white bread, white rice, and regular pasta with 100% whole wheat bread, brown rice, quinoa, and oatmeal. Whole grains are high in fiber, which helps control cholesterol and blood sugar, both of which are risk factors for stroke. It's a simple swap that makes a big difference. For protein, choose lean sources. Think fish, especially fatty fish like salmon, which is rich in brain-protective omega-3 south, along with skinless poultry, beans, and lentils. And don't be afraid of healthy fats. Nuts, seeds, avocados, and olive oil are excellent choices that help fight inflammation in your arteries. A handful of almonds is a far better snack than a bag of chips. Now, let's talk about what to reduce. The number one enemy here is sodium, or salt. Excess sodium makes your body retain water, which increases blood volume and raises your blood pressure. The biggest sources aren't usually the salt shaker on your table, but the hidden sodium in processed foods, canned soups, frozen dinners, cured meats, and fast food. Start reading labels. You should also dramatically cut down on saturated and trans fats. These are the unhealthy fats found in fried foods, commercial baked goods, and fatty cuts of red meat. They directly contribute to the buildup of those dangerous plaques in your arteries. And finally, watch out for added sugars, especially from sugary drinks. They contribute to weight gain and diabetes, both major risk factors for stroke. Making these dietary changes isn't just about prevention. It's an investment in your long-term vitality. Every healthy meal you choose is a step away from a potential stroke and a step toward a longer, more vibrant life. But diet is just one part of the equation. Let's look at the other lifestyle changes that are just as critical. Beyond diet, there are 3 other critical lifestyle pillars you must address. The first is non-negotiable. You must stop smoking. If you smoke, quitting is the single most effective action you can take to reduce your stroke risk. Smoking damages your blood vessels, makes your blood stickier and more prone to clotting, raises your blood pressure, and lowers the amount of oxygen your blood can carry. The second and third pillars are managing your other chronic conditions, specifically diabetes and high cholesterol. Uncontrolled blood sugar from diabetes accelerates the damage to your arteries, making them hard and narrow. Similarly, high levels of LDL, or bad cholesterol, are the primary building blocks of the fatty plaques that clog arteries and lead to ischemic strokes. Working closely with your doctor to manage these conditions with medication and lifestyle changes is absolutely essential for stroke prevention. But what single action helps manage blood pressure, diabetes, cholesterol, and weight all at once? The answer is physical activity. Regular exercise is one of the most powerful medicines we have. It strengthens your heart, improves circulation, helps control your weight, and makes your body more sensitive to insulin. We recommend at least 150 minutes of moderate intensity exercise, like brisk walking, swimming, or cycling per week. That's just about 30 minutes, 5 days a week. You should also include some strength training 2 days a week. Now, I know, being active can feel vague. It's easy to lose track and lose motivation. One of the best ways to stay consistent is to actually track your progress and see your daily improvements. It turns the general advice of exercise more into a clear, personal, and achievable daily challenge. A good fitness tracker is an excellent tool for this. It doesn't have to be complex or expensive. It just needs to help you monitor your steps, track your activity minutes, and set daily goals. It's a great motivator to take the stairs instead of the elevator or go for that extra walk after dinner. I've added a link to a great value tracker I recommend in the pinned comment for you to check out. This combination of poor diet, lack of physical activity, and rising rates of obesity is exactly why we're seeing more strokes in younger people. The damage that used to take 60 or 70 years to build up is now happening in 40 or 50 years. This isn't an old person's disease anymore. It is a disease of lifestyle, and that means prevention must start now, no matter your age. So let me ask you, what is one small change you can make today to lower your risk? Every choice matters. We've covered the fundamentals, but for those looking to go a step further in protecting brain and artery health, omega-3 fatty acids are incredibly important. And speaking of omega-3, I know many of you ask about which supplements to choose. It's a valid concern, as quality varies greatly. To save you the research, I've linked the high-purity omega-3 supplement that meets my quality standards in the resources list. To find that, along with the blood pressure monitor and fitness tracker we discussed, check the first pinned comment below this video. I've put everything there for you. Thank you for investing this time in your health today. And if you enjoyed this content and want to continue your journey to a healthier life, check out the videos appearing on your screen now. I'm sure they'll help you immensely. Click on one of them, and I'll see you there. I'm Dr. Kenji Sato from the Senior Wellness Center. Remember to subscribe for more content to help you live a long and healthy life. Stay well, and I'll see you in the next video.